our press conference. My name is Diane Mihalik. I am the Chief Marketing and Corporate Communications Officer for Munson Healthcare, and I'll be your host today. Today is Tuesday, March 16th, and thank you again for joining us. In addition to these press conferences that are intended to keep the community updated on the latest COVID-19 information and updates, you can also stay connected to Munson Healthcare by signing up for our electronic email newsletter, following us on social media, or visiting munsonhealthcare.org, where we have an entire section of COVID-19 information and FAQs that are updated frequently. Next slide, please. So I'm happy to have three doctors joining us today that can help answer all of your COVID-19 questions. Dr. Nefsi will be joining us again. She's the Chief Medical Officer for Munson Healthcare, and she'll be kicking us off in just a minute with some of our standard reporting numbers that we give. Also joining us today again is Dr. Mark Cannon. He's an infectious disease expert with Munson Healthcare. And joining us for the first time will be Dr. Christopher Ledke, also infectious disease expert with Munson Healthcare. Next slide, please. So without further ado, I'm going to hand it off to Dr. Nefsi, the Chief Medical Officer for Munson Healthcare. Welcome, Dr. Nefsi.
Thank you, Diane. So we'll go ahead and start with the numbers. You can see here our cumulative numbers of cases, both in our Munson Healthcare region as well as the state of Michigan. And I will actually point your attention down a little bit lower to our cases per 100,000. So we are currently at a 5.2% infectivity rate in the community, which is done on a cumulative 2-week rolling average, and we're at 240 cases per 100,000. We reported last week that we had seen an uptick in our numbers, and this week, unfortunately, we are continuing to see the same trend with an increase both in the number of cases we're seeing in the community as well as our cases of hospitalized patients. Next slide. So there you can see our COVID-19 positive inpatients at our Munson Healthcare hospitals. And we'll go to the next slide. Here you can see the trend line. So if you'll look at that last bit, so certainly we are not back to where we were in kind of the December time frame. So if you had looked at our numbers today compared to where we were then, we would have been pretty happy. But you can see there we had a nice dip down, and we are now trending back up in the numbers. So certainly not the direction we would like to be headed. Next slide. On the vaccine front, we do have some good news. You can see here the eligibility. This was a slide that had estimated opening for access to the vaccine on a month-to-month basis. The governor's office did report last week that on April 5th, the plan is to open vaccine to all people in Michigan, age 16 and up, who are not previously eligible. So as always, if you have been eligible, you're a healthcare worker, you're a teacher, anybody like that, you will remain open to get the vaccine, but we are opening it up gradually. So you can see starting on March 22nd, it will open up a little bit more to those 50 and up, as well as those with disabilities and pre-existing conditions. And then on April 5th to all Michiganders. Next slide. We are currently not doing any mass vaccination clinics in Munson Healthcare, so we are not scheduling any additional first or second dose clinics. However, we continue to work very closely with our primary care clinics in distributing vaccine and supporting them in that distribution to their patients, as well as to our local health departments. Additionally, there is a federal program that is distributing vaccine to local pharmacies, and they seem to be doing a good job in additionally distributing vaccine to our population. So this is really an all hands on deck, supporting our community and getting as many vaccines into arms as we can in whatever way we can. Next slide. So as of today, We have distributed or administered rather 34,465 vaccines, and we have currently just over 66% of our Munson Healthcare workers vaccinated. We are about to start spring break, and we did want to just remind people about some travel reminders and tips from the CDC. You know, I think there is a lot of variability from state to state, and so we are really trying to stick with what the CDC's recommendations are so that we can have some consistency, and would invite anybody who is planning to travel over spring break to do the same. So one would be, if you are eligible, please get vaccinated for the COVID-19 or with the COVID-19 vaccine. There are several options available to you. Some places are requiring it, but even if not, and especially if you're going to fly, we would recommend that you get tested before you go to ensure that you aren't an asymptomatic carrier or early on in the illness. Always when you're traveling, we would strongly recommend you wear a tight-fitting mask over both your nose and mouth when in public. Always, we would say to avoid crowds and stay at least 6 feet or 2 meters away from people who are not in your immediate travel group or your bubble. Once you return, we would also recommend testing and staying home and self-quarantining for a full week after travel, even if your test is negative. If you don't get tested, we would recommend that you stay home and self-quarantine for the 10 days after travel. Next slide. Again, follow all state and local recommendations or requirements. And then especially if you're going to someplace with fewer restrictions, we would recommend that you stick with the more stricter guidelines. If you have been exposed to COVID-19, if you have any symptoms of illness, or if you have tested positive, do not travel. Next slide. So again, just so people are aware, masks are required on planes, buses, trains, other form of public transportation. Again, avoiding crowds indoors and out is important. As always, as we have said during this vaccine, it's very important that you wash your hands frequently, especially before eating or if you're in a public area, and try not to touch your face. It's a good idea to bring extra supplies of both masks and hand sanitizer with you. And just like we're doing here, if you can cook or bring your own food, if you can get carry out, or if you're going to eat out, if you can eat in an outdoor area where you can have good airflow and maintain distance from others, that would be a good idea. We would also recommend you consider staying separately from other households, other than your family that you have been with in your bubble or friends in your bubble, and practice the same safe gathering practices you would at home. Next slide. I'm now going to turn it over to Dr. Mark Cannon, who is one of our infectious disease providers at Munson Healthcare. Mark.
Hi there. Thanks very much. So I just wanted to sort of, I mean, we can address specific questions, but I just wanted to start off by maybe trying to address some vaccine hesitancy that's still out there, if that's okay. So we knew that the clinical studies for all these vaccines were incredibly impressive. Lots of people volunteered, lots of people with no benefit to themselves volunteered to be study participants, tens of thousands, hundreds of thousands throughout the world in all these trials. And the results are amazing. The results are incredible safety profiles, like most vaccines, to be honest, but even better than some that are quite common. Really very impressive safety profiles, and surprisingly effective, surprising effectiveness, higher than anybody really had dared hope. Some of the vaccines, well into the 90s, and others, even into the 80s. Fantastic results for any vaccine. But obviously, everybody has a sort of their own internal trust of vaccines, or their own internal trust of, I don't know, medicine in general or science in general. Some of us who know the miracles that vaccines have, accomplished over the past 100 years, and know some of the science behind them, or just have observed that the vaccines already with really no harm and lots of benefit. We were happy to be as far front of the line as we could to get the vaccine. Others, through whatever personal experience or opinions, are a bit more hesitant, and that's fine. But I think we just have to realize that, we all want what's best for not just ourselves, but our community as a whole. And these are not vaccines like, say, a pneumonia vaccine or a shingles vaccine, where really you're only hurting yourself if you don't get it. And no one's going to get too bent out of shape if someone declines their shingles vaccine. We might say, not a great idea, but it's not going to hurt anybody else. But this is a communicable disease. So this is a disease where you're not only protecting yourself, you're protecting your community. And given that is so incredibly safe, and the post-marketing studies have continued to back up both the safety profiles and the efficacy, which is key. A lot of people were saying, well, studies are one thing, but I'm going to wait to see what happens in the real world. Well, that time has come. That has happened in the real world. Millions of people have gotten this vaccine. They've gotten these various vaccines. No convincing deaths whatsoever. There have been deaths, but they are at the rate of that you would expect with no intervention, with no vaccine. There have been some blood clots with the AstraZeneca, but at a rate that you would expect at a baseline population, 30 out of 5 million, which is what you would expect anyway. So no reported deaths from the vaccine, and an extremely low incidence of serious side effects, which they themselves are manageable as well. And of course, the usual side effects from vaccine that everybody gets, sore arm, feeling a bit, under the weather for a few days, small price to pay. So I guess that's where I am as far as my general philosophy in trying to understand vaccine hesitancy. But I just urge people to revisit what are the real reasons that they don't want the vaccine. Do they still think those reasons are valid? And with all the incoming data and all the experience now we've had with these vaccines, and the millions of people vaccinated, if they were hesitant at first, are those reasons still there? They need to examine whether their opinions have now changed, and whether they're, willing to step forward and, be part of the, a broad effort, human-wide, to get this under control. And so we can go to some specific questions if people have specific issues.
Dr. Cannon, there's, if we could go to the next slide, please. I think you wanted to just, we had a report that you wanted to address with the adverse rate.
Oh, right.
Slightly more than.
So I did mention that post-marketing studies have shown that the vaccine, like the original studies, post-marketing studies have borne out those very good results. And recent studies were done looking at just incredible numbers of vaccine recipients and looking at adverse events, and the overall adverse event rate was a little more than 0.02%, which is down around placebo levels, and that would be a minimum expected of any medication, any new vaccine or pill or anything. This is not above and beyond what you would expect for any. In fact, it's a lot lower than you would expect for something. And keep in mind that this sort of adverse rate, this sort of risk, is negligible compared to some of the risks we take every day. Everybody here just drove to work in 3 inches of slippery snow. And you're telling me a 0.02% risk is something you're not willing to deal with. You have to put this in perspective. And I think that again, these just bear out the safety of these vaccines. Whether you have, wherever your level of inherent trust is in big pharma or in big medicine or in science in general, the fact is there's now enough data by various sources to be very supportive of these vaccines. They did find there was, the occasional anaphylaxis case, which was 11 in a million, which is pretty low. And of course, anaphylaxis is well managed. Any place giving vaccines has the supplies on hand to immediately manage anaphylaxis, and again, no deaths. So I just thought that was a nice post-marketing evaluation that should reassure people.
Thank you, Dr. Cannon. I appreciate the update there. And we will have you back in just a moment to answer some additional questions. But right now, I'd like to introduce our third panelist today, Dr. Christopher Ledke, who's also an infectious disease physician with Munson Healthcare. Welcome, Dr. Ledke.
Thank you. That was a good summary, Mark. And I guess I wanted to give a couple other points about the vaccine. So as Mark mentioned, if people are waiting on real world data, they don't need to wait anymore. We have it. 70 million Americans have received a COVID vaccine. And I want people to understand that when a new vaccine like this gets used in the public, there is a prospective monitoring program called the Vaccine Adverse Event Reporting System, which is a robust system that is actively looking for significant side effects. And that is unique to therapies in that we do it for vaccines. We don't do that for a lot of other new therapies, medications, things like that. So as you saw with like the AstraZeneca vaccine, for example, that system played out in effect, finding a small number of clots, which likely is non-significant, but that reflects how closely these vaccines are monitored. So I guess I just wanted to be clear that that these vaccines have been used in millions of patients at this point and have been very well tolerated. And I would also like to reiterate what Dr. Cannon said about the fact that you're not just making a decision for yourself. You're making this for the community. So we would urge you again to get vaccinated if you have the option. I guess one more point. You're going to see efficacy data or effectiveness data on vaccines that have potentially different numbers between them. So for example, Pfizer and Moderna, which are mRNA vaccines, versus the Johnson & Johnson, which is an adenovirus vaccine, different types of vaccines essentially. And there is some lower efficacy data for the Johnson & Johnson vaccine, but I just want to make it clear that is in a different population at a different time frame, and it's a single dose, whereas the mRNA vaccines are 2 doses. So the Johnson & Johnson studies were done when there was a significantly higher transmission in the community and with more variants. So really they should be considered equivalent. So I guess my plug would be, if you have the option to get a vaccine, don't worry if it's Johnson & Johnson or Pfizer or Moderna, just get it. So I would just make that plug. I want to talk about variants a little bit because you're going to read quite a bit in the news about those. And to be honest, this is an expected downstream effect of uncontrolled or unchecked viral transmission. Is viruses replicate rapidly and pretty sloppily, to be honest with you. So you get these, many of them are non-viable, but the viable ones, particularly if they're more transmissible, they would become a dominant form. You saw this in the UK over the last several months with the what we know now as the UK variant became the dominant form in that area, because it likely has a higher transmissibility rate. And if you look at the CDC map for variants, Michigan actually has the second most variants in the nation besides Florida. So we have, it appears that we have quite a few circulating variants here. It's almost all the UK. We have a single South African variant that was documented downstate. So it's a real concern in Michigan, and it does not appear that the fatality rates or the mortality rates are higher, but what it likely means is that we will require a higher proportion of the population to be protected to acquire herd immunity. So herd immunity is directly related to the transmissibility of an infection. So if we're dealing with a higher transmissibility from a variant, then what we're going to need is a higher proportion of the population protected, which means vaccination. So another reason to get vaccinated and urge your family members to get vaccinated if they have the option. So it does appear on the studies that we have so far that the vaccines are protective, particularly for the UK variant. There's some data that it's not as protective for the South African variant, but it appears to maintain good protection for the UK variant, which again is the main variant that we have in Michigan. Can you go to the next slide? Yeah, so wanted to talk about quarantine a little bit because we are seeing still ongoing need for this strategy. And I do want to make it clear. So if you or a family member has been asked to quarantine by the health department, these very hardworking people at the health department are making recommendations based on expert guidelines that are national guidelines. Okay, this is not something that we're doing on our own. This is still our recommendation, and some of this has to do with the fact that still a minority of the population is protected. So the most people that you would encounter out in the community are not protected against COVID based on the proportion. So there is still a significant transmission risk. And again, that is often asymptomatic, particularly in younger folks. So if you, again, or a family member had a major exposure and you are not vaccinated, you still do need to quarantine, unfortunately. I would also say that, you know, based on what we project to be an increase in vaccine supply, it's like Americans will be vaccinated in the next few months. So to me, this reflects a light at the end of the tunnel. So ideally, we would see a majority of the population be protected with these, and then maybe we wouldn't need to quarantine. So that is hope. If anything else, it's hope. So, but that it requires us to actually get the vaccine. It does no good on the shelf. It needs to go in people's arms. So anyway, that's all I have for quarantine.
That's great, Dr. Ledke. Thank you for that explanation. And I'm going to ask that Dr. Cannon and Dr. Nefsi also rejoin us for the Q&A session. So thank you all for those great overviews and current updates. We do have quite a few questions coming in. I'm going to remind everyone that if you are on this Zoom call, you can submit your question through the Q&A feature. And if you are watching us on Facebook, please submit your questions through there and they will get to me, and we'll answer as many questions as possible. But like I mentioned, there are quite a few coming in and they're all a little bit different. So I'm going to start with Dr. Nefsi. One of our reporters who's watching is asking, as COVID-19 hospitalization numbers climb, are you looking at adjusting any hospital practices to make room for these patients? And are you planning to delay elective procedures, restrict visitation, or anything along those lines?
At this point, we are not. We have learned a lot about COVID and about taking care of people who have COVID. Also, a lot of the restrictions that we did before were related to our ability to test people, our testing supplies, as well as our PPE. Those issues have all been resolved. So as of now, we don't anticipate an impact on our ability to take care of other patients or to do routine procedures or those kinds of things. But certainly, you know, if our numbers went up significantly higher or something else changed, you know, with the supply chain, we would have to address that. But right now, we are hopeful that we'll be able to maintain just our normal operations.
Great. Thank you, Dr. Nefsi. Dr. Cannon, based off of your comments, there are two questions that are directed at you from some of our reporters out there. Are you hearing and seeing enough vaccine hesitancy that you're concerned there won't be enough people vaccinated in our area to reach herd immunity? And that would significantly slow the spread of the virus? And what would the consequences be if we never get to herd immunity?
Right. That's exactly, you know, what I'm worried about is that hesitancy. So these various vaccines are routinely tested against new variants. And as Dr. Ledke mentioned, some of them don't produce quite as robust a response to some of the variants when looking at antibodies. But antibodies is only one arm of the immune system. And taken as a whole, when you also look at cell-mediated, or what's called in the papers or press, sometimes you'll see T-cell mediated immunity. the vaccines are still very good at providing T cell immunity to the variants. And so the quicker we all get vaccinated, the less time the virus has to circulate and to create more variants. So even if getting a handle on variants is the same as getting a handle on the virus in general. So the quicker we can all get vaccinated and stop quick transmission from person to person, and easy transmission from person to person, then the whole worry about variants will also decrease proportionally because there'll be less spread. Virus epidemics, I think we've mentioned this before, I don't know if in this context, but viral infections, viral epidemics or pandemics, they've evolved in two big categories. One are those that cause sudden, very quick death and quickly run through the population and have no one else to infect and can't maintain their viability anymore. They got nowhere to live anymore because they've killed off too many of their hosts. And then they recess for, who knows, decades, hundreds of years sometimes, and then will reemerge, short pandemics, very deadly. Others have evolved to be very infectious, but not quite as deadly. And so those take a long time to go away. And this is sort of an example of that. The death rate as a percentage isn't enormously high, but because there are so many cases, the deaths are overwhelming. But that's why, is because there are so many cases and it's so infectious. So because it is so infectious, we do need a very high level of immunity before we can stop its transmission. If a virus has infected one person but has nowhere else to jump to because there's too many immune people around, that's how it goes away. That person's essentially a dead end host. It'll replicate in them, they'll get better hopefully, but it has no one to move on to because enough people have been vaccinated. And that will go for wild type virus as well as variants. There is also some interesting data, speaking of variants, they studied the South African variant, and there's a particular antibody response to that seems to be very protective against all of the variants. So, these vaccines will continue to be tweaked and they will get better and better. And they may need to be tweaked annually or every couple of years to keep this in check. And this may be something that's with us like flu, that's an annual thing. But once we learn more about it, once we have a larger level of just some baseline immunity, we can top that up and boost that as appropriate from population to population, from year to year. So short answer is yes. People being hesitant about vaccine is exactly what we're worried about, because that's what will cause this to just keep fluctuating up and down and up and down. And we open back up, we close back down, we open back up. Our economy is fits and starts, and nobody wants that.
Right.
Not to mention obviously the morbidity and mortality and the human suffering.
Thank you, Dr. Cannon. Also related to vaccine hesitancy, Dr. Ledke, I'm going to ask you to address this question. One side effect or concern I have heard regarding hesitancy is the quote unquote long-term effects, which we still don't know. For example, I've heard things like problems with infertility. Are there any studies on this yet? And can you address that?
Sure. So keep in mind that in order to get this approved as an emergency use, it required prospective monitoring of those who were vaccinated for at least 3 months, okay, for such a side effect like infertility or really anything. So they're actively monitoring these patients, and after it's approved, it continues to be monitored, as I mentioned. So you will hear about infertility in depending on where you look on the internet or on social media, but there is no concern over fertility issues with the mRNA vaccines is where you typically read about that. Now keep in mind that these vaccines are basically emulating the protein of the actual virus itself. So it's essentially exposing the body to the same thing that would happen if they actually got COVID. And we know based on millions and millions of those who've gotten COVID that there's no fertility issues with getting the actual infection. So that is not a real concern. This does not cause any fertility issues. There are no concerns in pregnant patients. There are no concerns in breastfeeding patients, and those folks should continue and should get vaccinated if they have the option. So there are no concerns over fertility.
If I could just chime in, the person that in the press who brought up the theoretical concerns about effects on fertility and pregnancy was somebody who had already been sort of debunked as somebody who had already had several COVID conspiracy theories that proved to be nonsense. He was an ex-employee of Pfizer, and published in a source that had been widely debunked already. It was a classic example of taking one tiny grain of truth and really extrapolating it to kind of ridiculous proportions. And as Dr. Ledke mentioned, if having an antibody response to this virus caused any infertility problems with the millions and millions and millions of cases worldwide, I think that would have been picked up. And so it is not it's not something people should be worried about in the least.
Great.
Yeah,
Thank
I
you
would
both.
add, Diane, the American College of Obstetrics and Gynecology has come out with a strong recommendation that pregnant and breastfeeding moms should get vaccinated when they can.
Great. Thank you all for the great answers. Dr. Nefsi, one additional question from a reporter. We are seeing a spike in school cases. However, it's been said that these are not necessarily in school related, but rather sleepovers, parties, possibly sports activities. With prom season and graduation and spring break travel, are there any updated guidelines or guidance for school children?
Yeah, we do work closely with our superintendents and school districts around to really stick with the initial guidance that was put out. So the American Academy of Pediatrics, there were a lot of different academies and groups that put together very clear guidelines of what sports activities should look like. I think a lot of what we're hearing is that those aren't necessarily always followed. And then the social events, we've been saying all along, you shouldn't be having sleepovers with people. You should be wearing masks if you're together with people that are out of your immediate bubble. So, I don't think that there's anything new, but we are absolutely sticking with the same guidance that we have been giving this whole time about ensuring that you don't have large group gatherings indoors, and that when you are getting together that you're masked and you do those gatherings as safely as possible. Nothing new certainly, but we would recommend, maybe it's a good reminder for people to dust off those initial recommendations and ensure that we're following them, because it's easy to get complacent. It's easy to, I get it. People are tired of this. And they want it to be over. And I think both Drs. Cannon and Ledke made a good point that, we have sort of an end point in sight. By April 5th, we're opening it up. If we can get enough people vaccinated, we will get past this, but we need to get to that point before we can let our guard down.
Great. Thanks, Dr. Nefsi. And one more question for you related to the schools. Are we seeing any children in our area with COVID-19?
We are seeing some, sure. Yeah.
Okay. And then I'm going to scroll through these questions a little bit. Dr. Cannon, can you just clarify one of your comments regarding the adverse effects of the vaccine? Can you clarify that no one has died as a direct result of getting a vaccination?
Right. That is what's currently being reported and currently thought based on monitoring people who've had vaccines and reports that come through medical journals and the press and such. There's obviously been concern that some events that happened to occur after vaccine was the vaccine responsible. And the way you figure that out is statistics. What would be the expected, rate of blood clots in the general population? Compare that to how many of them happened after vaccines. If they're the same, it's not a causal event. So that's how those things are determined, is the math. And there are people who spend their whole lives doing that sort of math and are good at it. And of course, everybody is watching all these vaccines probably more than any medical intervention in the history of the world. Well, I think I can confidently say that. And if there were any convincing deaths directly from the vaccine, we would know about these and they would be reported. No one is trying to hide that data. There'd be no benefit to anybody to hiding that data. We have lots of vaccines to choose from now. There really would be no benefit to somehow keeping that secret. And
That's
so
a really good point. I didn't think of that. Yeah.
So, so that is the current state of things, is that there's been no convincing reports of death directly related to any of these vaccines, which is completely expected because, how often have you heard of somebody dying from a vaccine? Been giving vaccines for decades. It doesn't happen. Vaccines are literally just asking your immune system to do something that they're programmed to do anyway.
Great.
You're just sort of jump starting them. You're sort of giving them a little taste to get warmed up in case the real thing comes along. There's nothing that vaccines do to your immune system. There are no toxins in there that are going to give you long-term effects. You're simply asking your immune system to, be ready. And all the vast majority of side effects that come from vaccines are because your immune system has been revved up. That's what causes fevers and aches and flu-like symptoms. It's just a sign that your immune system has been challenged. It's met the task, and it's doing its thing. So.
Yeah, I mean that's expected. There's a name for that. It's called reactogenicity. So like, I'm a younger guy. I got the Pfizer vaccine. After the second dose, I didn't feel well for 24 hours.
I didn't feel a thing. I was fine because I'm an older guy.
Because he's old. So, but anyway, it's expected, and it's an expected response from your immune system being activated, and we do hear that is that patients don't want to get the vaccine because they heard that somebody got sick from it. It needs to be clear that is expected in many patients, and it's not reflective of a serious adverse effect. It is simply your immune system doing what it's supposed to do, which is to have a response to a new threat. And so it's good. It means that you're able to mount a response, and it doesn't mean that if you don't get that response that it didn't work or that your immune system is weak. It's just an expected, a common finding.
Dr. Ledke, along the lines of some of the rumors that we're hearing about these vaccines and some of the hesitancy, we do have a question coming in from one of our viewers on Facebook. Why is there a narrative that the mRNA vaccines alter your DNA?
Oh, yeah, sure. So that's completely not how it works. So first of all, mRNA does not go into the nucleus. The DNA lives in the cell nucleus. Okay, all of this is happening outside of the cell nucleus. There's no involvement of the DNA of the host. Okay, and also mRNA is incredibly fragile. That's why it has to be kept in such conditions. It gets administered. It gets taken up by the cell. The cell basically makes the protein that is associated with the spike protein, basically using parts of the cell that are separate from the DNA. Okay, so it's asking your cell to do what it does all day long, which is to make a protein, and then that mRNA basically disintegrates. It's a temporary. It's like a message. Really, it's like I don't know, a text message or a transcript. It gets formed into a protein, and then it disappears. There is no alteration in our genetics and no involvement really in our genetics. It's really just asking the cell to do what it does all day long, but to make a specific protein that it doesn't normally make.
Right. If I could just point out, we've all been infected with RNA viruses throughout our lives. A lot of respiratory viruses are RNA viruses. Some are DNA viruses, like adenovirus. Some are RNA viruses, like coronaviruses. We've all had viral RNA and DNA in our cells many times, every time we get a cold. If the cell were, if our cells had evolved to be so sloppy and so careless that somehow RNA, which is a different molecule than DNA, could somehow recombine with each other, we wouldn't have made it this far. We'd still be a primordial soup. We wouldn't have evolved to complex organisms. That's not, that's not how cellular biology works, is the short answer.
Great, thank you all. We do still have quite a few questions here. Dr. Nefsi, can you just, one of the reporters is asking, is Munson Healthcare still getting any vaccine doses at all? And do we expect that to open up? Because you mentioned on one of your slides that we are not scheduling any more first dose appointments.
We are still getting some vaccine, and I think it's important for people to understand there are several ways that vaccine is being allocated. So there's a federal program that is allocating vaccine to the pharmacies. We have nothing to do with that. We don't know how much they're getting, when they're getting any of that. That is a completely separate program. Then there's a program that comes to the state health department, and then that is the vaccine that's being distributed based on our vulnerability index and need and past history with, the burden of COVID in each of our communities. Early on, we were able to ask for a number of vaccine doses that we felt we would be able to distribute. That is no longer the case. They are giving us how much vaccine they have, and there is variability based on, the manufacturing and a lot of other things. We saw weather impact a couple of weeks ago, that kind of thing. The state is really trying to look at like federally qualified health clinics, as well as health departments to distribute the vast majority of that vaccine. The vaccine that we are getting in removing ourselves from doing the mass vaccination clinics, we are sharing with our health departments as well as personnel to help support the distribution of that vaccine and giving it to our primary care clinics, both employed and independent, because they know their patients. They're the ones that typically would do flu vaccines and do all the other vaccines that we do on a regular basis. And so we really feel like they are the best position to do that. They're certainly the best position to know their patient population and be able to make a good determination about who is at risk, who are those people that have chronic health issues that need to get prioritized for the vaccine. So that we are still receiving some. That is how we are doing it. We have not received word on how many vaccines will be distributed by the April 5th timeframe, but we are hopeful that it will be broad, and certainly we'll be able to use as many venues as we can, whether it's pharmacies, health departments, primary care clinics, whoever it is, to get vaccine out as much as possible.
Great, thank you, Dr. Nefsi. This next question is for Dr. Ledke. If we had done a better job of controlling the spread, would we not be seeing so many variants now?
Yeah, that's a good question. Yeah, theoretically, I mean, mutations require ongoing viral transmission. Basically, that's how it works. It requires replication, and theoretically, if we had more effective preventative measures earlier in the outbreak, if we would have been more stringent with social distancing and masking, yes, I suppose we would have had lower risk of variants. That I think that would have been hard to obtain, because we even with the mandates that we had in place, it was clearly still transmitting. Even with closure of restaurants, bars, many of the children in school from home, there was still ongoing replication. It would have really required a vaccine or some more robust preventative measure to halt that outright, and I think there probably would have been a variant spread of variants regardless. So yeah, that's a tough question. It's not an absolute, but it should be clear that it did require transmission, and that really the only way to spread that is to stop transmission with vaccines.
Yeah, I think the short answer is that if we'd had less transmission, we'd have fewer variants and less widespread variants, because as Dr. Ledke mentioned, if a given person's infected, there's viral replication ongoing in the back of their throat, let's say, or even further down in the respiratory tree, and you get some variants that emerge that happen to be more infectious or happen to be a little more dangerous, higher morbidity rate, mortality rate. If those aren't transmitted off to the next person, they again, that person's a dead end host. They won't keep going. And so less transmission, the less issues there would be, which is why I mentioned before, everybody just needs to get vaccinated, and that will help with the variant concerns.
Great, thank you. Dr. Nefsi, just real quickly, someone is asking if you've already had COVID-19, should you still get vaccinated?
You certainly can if you are done with your symptomatic period. So, there is a recommendation, obviously, that you don't go into a vaccine clinic or out in public when you're sick. But once your symptoms are over, it is perfectly safe and absolutely recommended that you get vaccinated.
Okay, great. Thank you. We are out of time for the Q&A session, but a lot of the questions that are coming in are related to where someone can actually get vaccinated right now. So there's a lot of I know we talked a lot about vaccine hesitancy, but on the flip side, there's a lot of people still waiting in line to try to get vaccinated somewhere. So I want to pull up our community resources. For all of those of you who have submitted a question about where to go to get vaccinated, this is the current list of resources in our region. Again, we'll post these on our website. And, in addition to that, we know that little local pharmacies like Meyer have their own process for getting you on a wait list to one of these. So, I think as Dr. Nefsi mentioned, as the vaccine supply increases, hopefully there will be many more options for people to be vaccinated. But until then, these are the resources that are available. And again, unfortunately, Munson Healthcare doesn't have the supply or the doses in order to open up some new mass vaccination clinics currently, but we are, again, working with the local health departments to support them in their efforts. So I would just recommend that you continue to try these resources, and eventually something will open up. And I know just caring for some relatives downstate, this is happening. This is not just a Northern Michigan issue. This is happening all across the state. So I just want to thank our panelists today for all that great information. Dr. Nefsi, Dr. Cannon, and Dr. Ledke. We'll definitely want to have you back soon again to give another update on the current status of vaccines and current variants and all that. And until then, again, sign up for our e-newsletter, follow us on social media, or again, visit munsonhealthcare.org, where after each of these press conferences, we kind of look at what questions are being asked, and we update our FAQs accordingly. So thanks again, and have a great day.
Thanks, Diane.